welcome to the Glow Podcast. I have a very exciting guest here today, Dr. Egan. For those of you just joining the podcast, we are Tailored Marketing and we help skincare clinics, aesthetic clinics grow their business and increase their revenue. So if you're interested in learning more, put a comment below or send me a DM. And I am here with Dr. Egan. And so if you just want to kind of go ahead and introduce yourself, tell us a little bit about who you are, that would be amazing.
Sure. Hi, Taylor. Thanks so much for having me on the podcast. I've been looking forward to it for a few weeks now, so I'm super excited to be here. My name is Kendall Egan. I am a board certified dermatologist. I own a practice in Las Vegas called Las Vegas Integrative Dermatology, where I do traditional care and also integrative care for dermatologic conditions. So we focus on holistic health. I have had a lot of different hats in my medical career. I used to be a Navy doctor a long time ago, so I'm a weird dermatologist. I've done trauma and put in chest tubes and handled aviation mishaps and mass casualties and things. So I'm kind of strange in that regard. I'm not just your common or kind of straight through medical school to derm type of route. So I've done a little bit of primary care and also kind of trauma combat medicine. I live in Vegas. I have two little girls. Well, they're not little anymore. They're 11 and 13. And I'm married and I like to stay pretty active. And another weird fact about me is I used to swim in college. So I swam Division I when I was much younger. So I really love taking care of athletes too. That's another thing that I enjoy doing in my career.
Wow, that's awesome. Yeah, I feel like you have such a unique background with what you did with the Navy and everything. So that's really, really cool. I feel like it brings a new perspective to patients. And today we're going to be talking about kind of one of the movies that is a little bit pop culture right now. It's super, super popular and it's called The Substance. If you guys have ever heard of that movie, it kind of is a unique perspective into, the anti-aging craze that we're having right now. And so it kind of, without giving away any spoilers, it's like this magic pill basically that makes you younger, but only for a limited period of time and with some kind of weird stipulation. So we're kind of gonna discuss that a little bit today and kind of how it relates to just different things that are going on in our culture right now. And so do you think kind of with the rise of pop culture and anti-aging being such a craze right now that has kind of given way to maybe unrealistic expectations with patients when they're coming to you with certain issues?
Sure. I think pop culture does it, but I also think social media. So with the kind of invention or use of social media, I think we are in a totally different realm. Before,
Yeah.
people would focus mostly on celebrities and, oh, they look like this or they look like that. But now the information is so instantaneously and there's so many trends on TikTok and things like that now patients come to see me and they want things that they saw some influencer did. So, and some of it's true and some of it's not true. So I think social media drives most cosmetic things now more than actually the media.
Yeah, no, I completely agree with you. And I do think, on social media, obviously there's a lot of benefits with it too, of people being able to get good information, but then there's obviously also people that are giving bad information. And so there's pros and cons to it. Obviously everything kind of in our culture, but those bad things sometimes can get outweighed by the good things too. So in The Substance, it kind of explores this idea of very, very extreme physical transformations. What are kind of your thoughts on the way that social media and the media in general portrays these different beauty treatments and skin enhancements?
Yeah, so I think The Substance is a great movie. I think everyone should watch it. Every dermatologist should watch it. Everyone who does cosmetic surgery should watch it. And anyone considering cosmetic surgery should do it, above a certain age. I know you mentioned it to be a horror film, but I actually don't see it as a horror film at all.
Yeah.
I see it from more thought-provoking life choices. And then literally the substance is sense of self, right? You have this woman who's really super hardcore and has been super successful in her life and has been really creative in her industry. And then she gets to midlife and she's I'm in this situation where I feel like I need to make a change based on society or media or Dennis Quaid's character or societal norms or whatever. and she decides to pivot backwards. So she decides to reach for her youth when she has this great decision where she could have become Dennis Quaid. She could have opened up her own company and said, hey, I have all this great experience and value. I'm going to transition and pivot forward. And so I see the movie kind of like that. And I do see that in
Yeah.
my patients sometimes. Like they come to see me and there's this reach for youth instead of saying, okay, I'm now 45 or 40 or 50 or 55, and I have all this great life experience. How can I rejuvenate my skin and my look without trying to pivot backwards? I think pivoting backwards is super dangerous. And that's what I see in this movie is this reach for youth when we should be more focused on rejuvenation and kind of sense of self. And so that's how I see the movie. These scary cosmetic procedures, they're coming. And some people will jump into them. And some of these things are offered overseas earlier than the United States. And I do see some complications where people, again, are instead of kind of grounding themselves and saying, okay, I'm going to choose these cosmetic procedures because they're going to enhance my natural beauty at this season in my life, they're pivoting backwards and trying to reach too much to youth, like too much to being 18. You are never going to look 18 again, nor should
Yeah.
you.
Yeah, no, I completely agree with you. And yeah, I guess there were certain aspects of it where I thought it was kind of a horror film, but I agree with you that it was more thought provoking for people of like, okay, who am I now? Because we do go through different seasons of life, like you said. And so I know you mentioned when you were just talking about some scary medical procedures and that's some stuff that they're doing in other countries. What medical procedures are you referring to?
So there's something like I really specific, but anytime anyone injects things in your body or your skin, there's always a risk of infection and sepsis. So sepsis can kill you, and you can do very poorly if you get sepsis. There's a high mortality rate to sepsis. So if things aren't handled properly, so maybe there's bacteria or it's contaminated or there's something like that, and then someone injects that into your body, that is very bad. And sometimes we can't get on top of that. And so that could be problems. I've seen like silicone injections overseas, and
Yeah.
then people have like huge infections, or they have like what we call granulomas, where basically your body sends all these cells that are like, I hate whatever you put in my body. I am going to try to eat it and get rid of it, but it doesn't do a great job at it. So now you have all these bumps and like things that are really hard to get rid of because your immune system does not like foreign substances. So I would say infection and like immune reaction to things that are artificially placed in whatever part of your body are probably, to me, the highest risk. And then after that, anesthesia. And that is very important as well, as who's doing, if you're requiring anesthesia, that's incredibly important, because there's a
Yeah.
lot of things that can go wrong during that period of time.
Yeah, no, I mean, that definitely makes sense. And so, kind of going back to the substance a little bit, the film plays with the idea of self, kind of like we talked about. How often do you see patients kind of struggling with this, with the beauty standards that have been set by, whoever?
That's a good question. I think all the time. So I see patients, they come to see me for skin problems, and then we focus more on holistic health, right? And holistic health includes like mental health, activity levels, sleep, stress. It's amazing what you can do to somebody in terms of sense of self by taking away people's coping mechanisms like exercise or like social circles or things like that. And I don't think we hold enough importance into those things in modern medicine. So, for example, if someone comes to see me and they want kind of extensive cosmetic like interventions or procedures, my first thought is like kind of why
Yeah.
does this person want these extreme things? And there's usually a reason. They're usually having stress at home, or they feel undervalued, or they're missing kind of that sense of self, or they don't have those coping mechanisms in place. Maybe they can't exercise anymore because they have a super stressful job, or they're not eating properly, and so they don't feel good. And so I love cosmetic procedures and enhancing natural beauty, but I also feel there's such a huge component of holistic health. And when you look happy and you feel good, you look better. And sometimes I feel my patients that are wanting those extreme procedures are missing kind of that puzzle piece to like holistic health.
Yeah, no, I feel like lifestyle is such an important piece. And I mean, our bodies, they're systems. So everything's kind of working together. Like you said, if you're not feeling good, you're normally not looking good. So it's like,
Yeah.
instead of just doing a medical procedure immediately, but like you said, there's obviously always a time and place for that. It's like, okay, what else is kind of underlying below the surface that maybe we're not seeing? And yeah, so I feel like that's really, really important. And so with your patients that are coming to you for cosmetic procedures, maybe, or with certain things that they want to accomplish with their goals, how do you kind of manage their expectations in this world where they can get pretty high from like what we talked about, seeing things on social media?
Sure. So I think in every relationship, if it's like spouse, business, like personal friendship relationships, or even patient to doctor or doctor to patient, I think expectations are extremely important. So if people's expectations match, then most people have like a nice relationship, right? It's when those expectations become lopsided that those relationships suffer. So I really like to lay out all the expectations, and consider myself a pretty ethical doctor. So I don't like recommend anything I think is, one, not going to help, and two is like I don't, I have always practiced medicine with the mantra of like do what you would do for yourself or a family member.
Yeah.
And so when I approach these patients with these high expectations, I just want to make sure that they are on the same page as me in terms of what those expectations might be. And we do have discussions about like things like, oh, we could do that, but I don't think that's going to, give you the result that you might think it would. But I would suggest this, or we can do this, or, and if I feel like those expectations are still not communicated properly, sometimes I'll just, we won't move forward with that type of procedure, because I feel really strongly about taking good care of people, and I don't think taking good care of people is doing things without them having a complete understanding.
Yeah, no, I feel like that's really, really important, especially sometimes, patients are coming to doctors, and I know just like from personal experience, I obviously do not have the same understanding of the procedures of these medical terms that a doctor does. So when like when sometimes you go somewhere and they're throwing around a bunch of big words, you're like, wait, so what does this even mean? Like, are we speaking the same language here?
Yeah.
So it's like putting it in the terms where they can kind of understand and see that as well.
No, I totally agree.
So, kind of going back to the substance a little bit too, it revolves around a product that can completely transform the body, as we saw in the movie. In reality, what are the most cutting edge skincare treatments today that you're seeing with people that are producing positive results for people?
So I think the next realm is going to be like gene therapy or things like that. We're already starting to do like sickle cell. You see like CRISPR and Cas9, it's basically like if you had Microsoft Word open or whatever, Google Slides, and then you edit it like out your misspellings. Basically, they send something in, and the technology was developed from like bacteria and how bacteria protect themselves. They send it into your DNA, they cut out the bad part, and then they hopefully replace it with good things. And so that's exciting for like things like sickle cell disease or cancer. But I think there's an implication for like cosmetics and like anti-aging, which genes turn on collagen production, which genes like make telomeres hang out more, those types of things. But with those things, when you're altering DNA and stuff like that, there is always risks, right? So like, are we shutting off bad genes? Are we turning on genes that have other types of implications? Like, collagen sounds nice, but, scleroderma also has some problems with fibrosis and collagen and stuff like that. So I think that's where kind of things are heading, is more gene manipulation, like DNA manipulation in the future. We're not there yet. The other things, I mean, and they kind of implicated this with the substance, I assume, is like stem cells and things like that. Exactly what were they doing when they were like, extracting this stuff from her spine?
Yeah.
It's probably like, I don't know if they're going after bone marrow. It's probably a bad place to go after bone marrow, but, it's more dramatic and things like that. And then, stem cells are basically cells that can turn into anything. So that's why people are so intrigued by them. And so they have kind of this youthful property to them. And there's some of that going on. And then there's exosomes, which is really kind of a hot topic in cosmetics right now. But of note, the FDA has not proved any exosomes as being safe in the United States. So even though people are injecting them and doing things like that, the FDA still says, hey, let's be careful. We don't really know what the long-term implications of this. And there are like case reports of like, again, infections and things like that where people get really, really sick, So to answer your question, I think gene therapy is probably going to be on the frontier.
Yeah.
As things progress, and then there's ethical considerations that go into that too.
Yeah. And what ethical considerations, like, are you talking about with the gene therapy? Is it mainly, like, what I guess, would we need to be considering with any type of, like, biohacking? Because I feel like all of that's, like, it's not necessarily like biohacking, but it's all related to biology.
It is. So your DNA is like a recipe, right? And then when you start mucking with the recipe, things might turn out really well, and then they might turn out not so well. You might have, like, muffins that don't rise, or like, rotting food or something. And I mean, we're already doing this with food, right? With GMOs and stuff. Like, we're already manipulating DNA to create like superfoods that are resistant to things. And the same kind of ideas with people. Like, you alter their DNA or edit their DNA or whatever you want to say. Then the hope is that you can cure some of these like genetic diseases and kind of turn on genes, turn off genes that kind of help. Ethically, there's a lot of turning off and turning on, and what are you creating essentially? We're kind of driving away from kind of nature's recipe, and I don't know what the implications of that are. Some are probably really, really good, like, we can cure disease, and then some might be turning on stuff we don't necessarily want to turn on.
Yeah. No, like, there's just pros and cons to everything, and it's like we have to see if the pros are going to outweigh the cons, and even if they are, do those cons are they still just so great that it's like we can't do this for the pros kind of thing.
Yeah, I don't think we know the answer to all of that just yet, but some of it, we need to probably consider. Now, we have like academies and like governing boards in the United States that kind of look over that stuff to make sure things are safe. So that's like a good, safe process that we have in the United States. But, we're always kind of tinkering in things that might not be, 100% great for humans.
So the movie The Substance highlights the potential dangers of unregulated beauty treatments. What do you think are some of the red flags that people should consider when they're looking at different cosmetic surgeries or dermatological services and things like that?
So I think when I seek out any type of medical care, I want to know who is doing it. Like, are they certified to do it? Are they board certified? Have they gone through the proper training? And I think the United States in general, like, patients in general, don't have a great understanding of that. They don't understand kind of what board certification means because it's thrown around a lot. They don't understand length of training or people that are specialized in certain things. That's the one thing that I think people should pay attention to, is who's doing the procedure, where it's being done. And then when I look at things, I do look at the medical board. So I will like look up a physician or whatever in the medical board to make sure that they haven't been reported for, unsafe practices or things like that.
Yeah.
And then I want to say reviews, but reviews can sometimes sway based on like people's emotions. But mostly I look for trends. Like, is there a trend? Does everyone say like, oh, I got an infection, and there's like 100 people that got an infection? Well, then there's probably some truth to that.
Yeah.
Making sure that things make sense. So when people say I can revert or I can make you look like you're 18, that's probably not true. If they're promising these grand results, they're probably not somebody that you should seek care from. And I always feel like you should have a relationship with the person who's taking care of your eczema or acne or your cosmetic procedure. I'm not a big fan of like people jumping around. In fact, I don't really take care of people like that at my clinic. Like, my patients are like they're my patients. I take care of them. I have a lot of pride in them, and we have a relationship. And so there's a lot of transparency and a lot of communication. And so again, those expectations are communicated. And I think sometimes when you just run into a place because you're like, oh, it's got a good price, or they're promising these things, I think you can run into some problems. So I would check out all of that stuff.
Yeah, I feel like dealing with trust, especially with like a medical provider, is so important. So I feel like, it is important to have a relationship with your doctor, of course, because like they're the ones that are performing all these different medical treatments or giving you medical advice and things like that. And when you're talking about things that are important, you want to make sure that you're talking to someone you trust that knows more than you do too. And And what, in your experience, is like the biggest risk for people with overusing or really anything with injectables, lasers, or other cosmetic procedures as well?
So I like fillers, but and I like neurotoxins and I like lasers, but I like them used naturally. So I always tell my patients like, there's certain like concave aspects of people's faces that are there since you were younger. Like I look at my 11-year-old's face and she has a concave, like a depression under her eyes. It doesn't go straight from her eye to her cheek. And
Yeah.
so I think when people overfill, they start looking kind of like cats or things like that. They kind of get that more like, I actually really don't like it. It's like, it's a fake appearance, but it looks artificial because whoever's injecting isn't respecting those kind of natural areas of the face.
Yeah.
Same with the lips. There's ratios that need to be respected, and there's differences in ethnicities that also need to be respected. But I think when things go bad, they go bad, and there's some like addiction to fillers I sometimes see where people want more and more and more, and then they get overfilled and they just look really bad. And
Yeah.
so it's a big deal. Same with neurotoxins. When I first started derm a long time ago, we used to freeze people all the time, and now I do not do that. Like we do not freeze foreheads because it looks bad. It doesn't look natural. And also you can get atrophy of the muscles and things like that, which will age you. And I think now when you have these people that have been overfilling for years, we now know that the filler doesn't go away, right? It just kind of migrates. So people that have been doing lip fillers, now they have like big, upper cutaneous lips, which is just the skin below your nose. And that looks bad. You start
Yeah.
looking like a cat again. Then if you've been overfilling for years, you're really pushing yourself into a facelift probably earlier in life because now you've stretched out your skin essentially. And so, if you dissolve the fillers, you're not going to be happy. So there's lots of, I think with overfilling and overtoxing, you just have to find someone that you trust that understands the underlying anatomy really well and then also kind of respects those natural features of the face and won't give you the filler. Like if someone comes and wants me to put more filler and I don't think they need more filler, I will say, no, like you don't need more filler. Like I
Yeah.
will not do it.
Yeah, no, for sure. I think that that's important too because a lot of places, they're not going to tell you, oh, you don't need more because obviously they're going to make more money if you get more. So a lot of places I feel like are, they're also giving the patient what they want, but maybe they're not being as ethical with it,
Yeah. But I also feel like my patients, like I take pride in their result too. Like I don't
Yeah.
want them to look like a cat or whatever, and then say someone asks who did that, and they're like Dr. Egan. I was like, no, like I did not do that. And I think a lot of patients don't want that. Like patients come here
Yeah.
they're kind of scared of fillers. They're like, I don't really want that. I don't want to look like that. And there's some education with like fillers are great. They just need to be used properly.
I do feel like because you see the people who look bad from fillers, you don't see, because the people that look good from fillers, you don't know they have them.
Exactly. That is the goal. Like I always tell people, I don't want them to know you did anything. Like you should look rejuvenated and rested and more youthful, but no one should know that you've done fillers. And that's
Yeah.
kind of my goal.
For sure. And you talked a little bit earlier too about the like addiction people can kind of get to like fillers and Botox and things like this. What do you think, like from a provider perspective? I mean, I know it's like human psychology kind of a little bit, but what do you think from a provider perspective that this is like, what are people doing with kind of that addiction? Like, what is it feeding?
Well, dopamine. So
Yeah.
it's like a drug. So we know that like your dopamine levels increase if you take like cocaine or,
Yeah.
methamphetamine or something. So it's kind of similar. I think people get addicted to it just like they can get addicted to tanning beds or they can get addicted to drugs or whatever. And for some reason, some people have more of kind of that need to be, to have things or they become more into that cycle of addiction, more so than others. And then again, it goes back to holistic, like what else is going on? Like, why are we not developing or like supporting our sense of self and value? And why do we want these extreme cosmetic procedures? Is it because we're not doing other things in our life, like exercise, or we're in bad relationships, or we are stressed out, or whatever? Everyone wants to look good and feel good, but when you get those extreme types of cases, you're like, there has got to be something else going on that's kind of driving this need to overdo it, essentially. essentially.
Yeah, for sure. And when I guess if like you have seen that with any of your patients, like what are your recommendations to them to like, like you said, exercise and having a social circle? Is there anything else that you would recommend to people when you're like, okay, like let's look at your lifestyle kind of as a whole?
It really depends where they are in kind of their acceptance. And I mean, it's basic kind of psychology, right? Like, are they ready to kind of embrace this or they're not? Even with
Yeah.
smoking, we know like it takes like 7 to 8 attempts to stop smoking typically. So there's going to be like some, back and forth. And if they're ready to do it or if they're not, I mean, I think some patients may not want to see me because they want like 20 fillers every month. And that's an
Yeah.
exaggeration, by the way. And so they choose to go somewhere else. They'll get all of those extensive fillers and they may not want to choose to work on, kind of what's going on or kind of evaluate that. And that's okay. They might not be ready for that. And it's their body and ultimately it's their decision what they want to do.
Yeah.
But they do have to be ready to kind of address those issues, I think.
Yeah. No, and I guess what brought you, because obviously you're a dermatologist, but you do have this very holistic approach to health in general, really. So what do you think kind of drove that for you towards having a more holistic approach?
I think it's my Navy background too. Like, we practice pretty holistic medicine. I mean, I lived on an aircraft carrier for 2 years when I was younger and was deployed twice for like 8 months at a time. And I was involved heavily in like smoking cessation and like diet and like weight management and things like that with people. And so it was a unique experience to kind of see because they can't escape. They are on the ship too with you. So you get to see
Yeah.
what they're eating, how they're managing their stress, the stresses in their job. I mean, I can see all of that. And so it was kind of this unique experience where it was great to practice holistic health, right? I could see everything going on. And then I've just had experiences in my life where I've, been around people that have been sick, like family members that, got some sort of bad disease. And I didn't feel like they were like taken care of holistically, right? So they may have had this very serious diagnosis and then, they had so many specialists trying to take care of them, but no one was really kind of looking at things that mattered to the patient, first of all.
Yeah.
And then holistic things were missing, like eating or sleeping or things that are really important for making you feel good or activity level. We're just always so focused in modern medicine on, okay, someone has a disease. Let's fix it with medication, and we'll kind of suppress things and we'll try to make people better that way. When I think ultimately we're really missing is this huge component of like supporting people so that they can fix their underlying health disease. We still need traditional medicine. I am pro traditional medicine for sure.
Yeah, for sure.
But we need that kind of scaffolding, that support system. If you take exercise away from me, I will become very grumpy.
Yeah.
Like my coping skill will go away and my health is going to deteriorate. So I think we just don't have time in modern medicine, and we're so kind of looking at diseases and how to fix and suppress them that we're kind of missing that scaffolding that's going to help them do better as you treat them traditionally.
Yeah. And a lot of those things too, with like more of the holistic health aspect too, it can kind of be part of like almost preventative care. I feel like that's like a common word right now. It's not really like necessarily preventing anything specifically, but it's just like helping you stay healthier for longer, is what it is supposed to do.
Yeah, well, even like my medical derm patients, like they'll come in for eczema or whatever, or acne, and I prescribe exercise because like
Yeah.
we know that like cortisol levels like worsen skin health, mood like affects skin health, and like we look at gut microbiome and dysbiosis and things like that because it's all connected, in terms of like optimizing your health in general. So I think it's
Yeah.
for everything. It's every specialty should be looking at holistic healthcare.
Yeah, for sure. Yeah, no, I mean, I think that that's great. And then I guess this is kind of going back to talking about some of kind of like the more extreme things too.
Yeah.
If a substance existed, like in the substance where it kind of turns back time for you, and it's has very large repercussions, but like hypothetically if this happened, which it would never get approved, but hypothetically do you think that people would still use it?
Yes, I do. Um, Unfortunately, I think sometimes people have this like immediate, I think also it's driven by kind of again social media and like dopamine addiction and things like that. And the kind of this scrolling addiction that people will make decisions based on more impulsivity lately than kind of considering kind of long-term benefits. So I do think people would use it, unfortunately, but that goes back to like kind of driving society with developing that sense of self and like coping skills and good decision making skills and things like that. Um,
Yeah.
and making good decisions based on your holistic health, not just, I'm going to look 20 for 10 months and then I'm going to look like, it's going to be a bad outcome or something.
Yeah.
Like,
No.
yeah.
Yeah, no, I mean, I definitely agree with you. I'm sure there still would be people that would be willing to try it even if it wasn't FDA approved. But obviously, there's obviously still people that understand the long term benefits and they're not just looking for short term things. And so I guess I would love for you to tell my audience kind of how they can find you, what's the best way to connect with you, find
Sure.
your practice, and all of those things. And I'll also put it in the show notes as well for easy access.
Okay, perfect. So I'm in Las Vegas and it's called Las Vegas Integrative Dermatology, and we're kind of a boutique clinic. So there's no rushed appointments. You're not going to be seen for 2 seconds. There's no huge filled waiting rooms or things like that. And we just like really try to take care of patients. That's our mission statement. We just take care of people.
Yeah.
And so that's what we do every day. And so we do traditional care here. So I do a lot of traditional care, but I do integrative care as well. Some of my patients like more integrative and some patients more traditional. So I think we're a good fit for people that want kind of that high quality patient care. And they want more time with their physician, and they're looking for kind of alternative therapies, or they want second opinions. We see a ton of second opinions here,
Yeah.
but also they want that relationship with their doctor. They want kind of that old school, like, hey, I know my doctor. My patients know my kids. They ask about them. I know their kids, well, what they're doing in life. And we're genuinely interested. We want to know what people are doing. And we have such interesting patients that have all these neat things that are going on. So if that's something that your viewers would want, they can always find me. Our website is just www.lasvegasintegrativedermatology.com. We have social media, but we also, our phone number is 702-930-6441. But a lot of our patients book online. We do have telemedicine options for California and Nevada, but I always love seeing people in person. Like I can
Yeah.
do telemedicine, but I just don't feel like if you're in Las Vegas, you should come see me. Like you
Yeah.
should come to the clinic and like so I can see your skin and we can take good care of you at least for the first couple of times until we figure out what's going on. So that's how people can find us. We're all kind of word of mouth. We're not like owned by anybody or anything like that. So again, we're just here to take good care of people.
Yeah, no, I love that. That's amazing. And like I said, I'll put all of that in the show notes for easy access. And I really, really appreciate you coming on. It was great kind of getting to talk a little bit more about the movie and how it really relates to what's going on right now with everything that's going on and healthcare innovations and things like that. So thank you so much, Dr. Egan, and I really, really appreciate it.
Yeah, thank you. I had such a good time. It was so nice to chat with you.
Thank you. Bye.
Bye.